Medication errors happen when people give the wrong medication or they give it to the wrong person.
One of the biggest challenges I hear from staff is that they have to go to so many different places to get information.
We need data, and we need good data.
BC Mental Health and Substance Use Services delivers the most highly specialized care for people with complex needs in the province.
Some of our patients come in and they don't know their whole health history or their medication history. Staff often have to ask them lots of questions when they first arrive. That can be really hard for patients when they've just arrived at a new site. In the new system, staff will have easier access to all of their health information and won't have to ask them all those questions.
One of the challenges we have at Correctional Health Services is that BC Corrections will move clients around their different facilities. The chart doesn't travel with the patient, but with CST, the chart is always there when we need it.
And we know that in a forensic service or any mental health service, those transition points are the highest point of risk for staff safety and patient safety. It's essential we get the information passed in a timely way and an effective way between the teams.
CST will allow them to have access to that information in one location and will decrease the amount of time they have to spend going and searching for that information so that they can spend more time with patients.
I recall when I was on the floor as a nurse, often having to interpret the handwriting of a physician. In the new CST system, being able to scan and get a patient's medications on the computer system and having physicians be able to order right into the system, it really will reduce those errors.
Good data drives good care. For example, if I know how many patients have hypertension or diabetes, then that gives me an idea of what sort of care we need to provide. One of the great advantages of CST is having clinical pathways within the system. For example, with opioid use disorder, there's various different ways of providing opioid agonist treatments. CST allows us to standardize this and provide protocols that are evidence-based.
Our programs right now are the best that we have, however, they are outdated. We need to move and transform it to a service that catches up with the improvements in the technology so that we are reacting to all the other improvements in the other areas of the program.
We will have completely electronic records, and that will give us really good information on our patient population, as well as the treatment approaches, the quality of care, and the outcomes for our patients.
CST is probably the next best thing since sliced bread. I've been waiting for CST for so long, and what it can do is improve the care that we can provide to clients on a spectrum that is beyond anything we could imagine.
We have the opportunity to be the first group that goes live with CST in Provincial Health Services Authority, and it's a really exciting opportunity for us to be taking a cutting-edge approach to improve our patient care and to really address the needs of the most vulnerable population in BC.
And if we can move towards a system that helps us make the staff and patient safety better, we can't really not want to do it.